So we partnered with this clinic here, Nary Clinic, a few years back to do the community health worker program to really build that systems linkage with the community. And it's a model that's been proven time and time again to be very effective in not only improving care utilization and care quality, but also reducing stigma, improving quality of life, and just general advocacy for epilepsy and other medical conditions. So we know it works, it's just unfortunately underutilized.
But this time around, when I just come for the visitation, she can even run for me. So a lot of child development, you've seen a lot of development in her. Yes.
People with epilepsy anywhere that they're at should really be able to access good quality care, because we know that the vast majority can succeed on simple medication treatment. That is just a known fact that does not change in what region you're in. It's just a matter of getting them that treatment and their understanding of how to use that treatment.
This is the grandmother, by the way. And this is the mother. Okay, she's saying before she started, she was enrolled onto the program. She used to have like 3 seizures in a day. She would stop a bit, then she'll start again. And that time she wasn't taking any medication. But ever since she was enrolled on the program and started on medication, she has really, really improved.
So what we did with support from Roe Foundation was to develop training materials that were simple enough that it can be delivered through a community member. And we gave them some basic education on epilepsy because they should obviously know the condition they're managing. But we also gave a lot of education on how to communicate basic lessons to families about managing care of seizures at home.
This information that was in the compound about epilepsy was different from what we learned. When someone has got epilepsy, maybe if he have seizures, you touch him, you find that that person, you also be affected. That was the information which was in the compound. So usually people, when someone is having seizures, they run away, leaving that person alone, which is not right. To what we learned that that person needs to be cared for.
We started on the program 2 years ago, 2019. When did that all start? Even when they saw a child having a seizure, it was difficult for them to explain to the parent what was happening and what was supposed to be done. But after the training, they were given knowledge to explain to the parents confidently and explain to them that they should go and get medication. So now even when somebody comes to her and says, my child has a seizure, she has confidence on what to say to them and to advise them on where to go and why.
Yes.
Yeah.
So that was the basis of this project, was really to do it on a systematic level where we have people from within the community connecting the families to a accessible health clinic, a clinic that has capacity to manage basic epilepsy, and a referral system to send them to the specialist care when needed, and then to go back and forth so that it's not, the family feels like they always have to go there. And that increase in access, I think, makes all the difference.
3/4 of our children who are on our program, they have stopped having seizures.
3/4?
3/4, yes.
Wow.
They have stopped having seizures. We've had stories where a mother has told us to say these children was fitting nearly every day. Yes. But after they have been on medication on our clinic, they have stopped having seizures.
He's not fitting. He's not fitting now.